Hi everybody, Dr. Connie here. So when given medications to take, how many times have you questioned exactly what that specific medication is doing in your body? Have you ever wondered why some lupus or other chronic disease patients do better than others? Or have you noticed that while some people may be sensitive to certain foods, others can eat anything and still have great energy and are as healthy as ever? I used to wonder too. As a twin, my twin sister was blessed with all the good, healthy genes, and I, not so much. I'm a type A person who needs to constantly feel like I'm busy moving forward, while my sister can be just as content having a night out with friends with no real plans for the day, week, or even the month. She can sleep all day while I can be up at the crack of dawn out for a jog. And growing up, I leaned towards healthy habits, at times having OCD tendencies that alienated my friends and family. But I got lupus, and no one in my family has lupus. And when I was diagnosed, I was truly puzzled and deflated. I see the same scenario play out in my clinical practice. While some patients can regenerate and restore their functional status, some just struggle to heal. Some are constantly struggling to feel better, while others, it just comes easy. What's more puzzling is that many times this is not correlated with lifestyle habits. I've treated patients who are clinically obese, eat a poor diet, and yet come in with perfect labs. Cholesterol, glucose, liver, kidney markers are absolutely perfect. On the other hand, an elite Ironman athlete who is as fit as they can come can have out of control cholesterol. There's no rhyme or reason at times. So today, I'd like to talk about medications typically prescribed for autoimmune conditions, how they work, their herbal counterparts, and their effectiveness in modulating our immune response and also our tendencies to metabolically dispose of them. First, some terms to discuss. So DMARDs is what's considered disease-modifying anti-rheumatic drugs. These are commonly prescribed for autoimmune conditions. And then there's the biological response modifiers, and there's immunomodulators, and there's pharmaceuticals, biologics like Benlysta, etc. They're newer drugs in the market. And then there's the immunosuppressants like chemotherapeutic drugs as well as corticosteroids. What's important to remember is that the goals for any immune medications are to downregulate the inflammation, increase resistance against infection, and prevent long-term autoimmune disease and cancer. Our innate immune system and acquired immune system are typically the targets for these drugs. For the context of our talk today, though, innate immune system is our initial immune response to an infection to kill off the offender, such as a flu or bacterial infection. While this occurs, we experience redness, high temperature, increases in white blood cell counts, and some pain and swelling might ensue. And an acquired immune system is when the initial acute response becomes prolonged and fails to shut off. This is typically what's correlated with or associated with autoimmune response. Our cells signal each other constantly to enable such systemic response, to protect and fight, and also to kind of modulate and maintain homeostasis in our body. Some typical immunomodulators are as follows. So there's corticosteroids like prednisone. There's NSAIDs, non-steroidal anti-inflammatory drugs like Celebrex or naproxen, ibuprofen, etc. And there's statins to lower cholesterol, and chloroquine, which is Plaquenil, and opioids, which are considered immunosuppressants. And then there's the biologic immunomodulator, which are as follows. There's the hormones, stem cell therapies, there's vaccines, immunoglobulins, and monoclonal antibodies like Humira, Benlysta, etc. And then there's the DMARDs. As I mentioned, they're disease-modifying anti-rheumatic drugs, and they are essentially anti-metabolites, which are powerful drugs that target our T lymphocytes that affect our DNA, which is non-reversible and has powerful side effects for that reason. They include methotrexate, azathioprine, which is also known as Amiran, and leflunomide, mycophenolic acid, which is also known as Cellcept. Next group of drugs are mainly involved with TNF-alpha inhibitors, also under the category of DMARDs, which are basically modulating the inflammatory marker in our body, which is the TNF-alpha. Right? So they include Remicade, Enbrel, and Humira Pen. Just a little trivia about Humira. As mentioned earlier, Humira is a human monoclonal antibody used mainly to treat rheumatoid arthritis. It's the best-selling pharmaceutical to date. In 2013 alone, retail sales were $5.4 billion, and average cost for a U.S. patient per month is $3,100. The number one autoimmune disease in the United States is RA, rheumatoid arthritis, and it's on the rise. So this particular drug company is doing really well. But I digress. All such drugs are aimed at disease progression, and the goal is to start care early to prevent progression and damage to the body. Problem is that this is all downstream medicine, meaning we're treating the effects of our disease rather than looking for the root cause. So a good example is running faucet. Instead of looking to turn the faucet off, you keep mopping the water off the floor. And over time, you'll get tired, just like your cells get tired of cleaning up the mess caused by the toxicity of the medications. And just like how the floor will be damaged, this will cause some structural damage to our cells and eventually our bodies because of this incessant offense. Another reason why I'm so passionate about this is that there are various herbals and nutraceuticals that affect the same pathways as the medications, without the side effects though. And they are much more gentle on the body as well. Not only that, they also help our bodies reestablish homeostasis to allow for healing, so that we can reverse this and turn the faucet off once and for all. Another element not discussed by your doctor is lifestyle often, which includes eating, exercising, and stress relief, as we're particularly vulnerable to any compromise as lupus or autoimmune patients. Not once has my rheumatologist spoken to me about my diet. But this is not their fault because they had a bigger problem, or they usually have a bigger problem to deal with. But the problem is that there is a growing body of research to indicate the link between diet and disease, particularly autoimmune disease. So remember that all such meds in each class aims to shut off or alter one specific metabolic pathway that is affecting our immune system. The problem again is that once you mess with Mother Nature and turn that pathway off, this creates another problem, including all the side effects and even death. So such class medications such as immunomodulators are not new. There's natural immunomodulators were used in every indigenous population since the beginning of time. However, they're dismissed because back in those days, they didn't have the ability to validate such effectiveness by conducting double-blind studies. Something to be said about the timeless wisdom. Our ancestors' inherent understanding of our health and disease cannot be refuted, especially looking back at the history of Oriental medicine. Herbs and mushrooms in particular have been used for millennia for various medical purposes. Their primary use was for wound healing and infection. So how do you affect our immunity with nutrients? One, by enhancing our gut barrier integrity, limiting gut permeability, and upregulate our antimicrobial potential, and priming our immune system to improve pattern recognition in our cells, restore detox balance, activate our innate cellular defense mechanisms, supplying our body with essential nutrients such as vitamin A, D, B12, C, E, and folic acid, and getting complete amino acids in our diet, especially glutamine, glycine, taurine, and arginine to help our body detox. As an example, vitamin D is considered a potent immunomodulatory hormone, yet we lupus or autoimmune patients are deficient and at risk because we are told to avoid the sun and have a real sun sensitivity. So with all this said, we know that nutrient status can play a huge role in our disease progression, yet most lupus and autoimmune patients rely solely on meds to control the disease progression and often overlook the potential for food as medicine. I'm not advocating managing your disease without medications at all. All I'm saying is that while we use medications, it's so important to replenish your body with necessary nutrients to support it, to ultimately help it to reestablish its balance. So what do I recommend for autoimmune supplements? Well, for one, probiotics, because it helps to decrease gut permeability, enhance our natural killer cell activity. It also helps to decrease cancer risk up to 62%. It prevents upper respiratory tract infections, improves gut permeability, immunoprotective, inhibits toxins, and has anti-inflammatory effects. Two is to incorporate lots of green leafy vegetables because they help to normalize functioning of the T helper cells, which results in improved T lymphocyte and natural killer cell activity, which also decreases antibody response. Curcuminoids, which are powerful anti-inflammatories proven to be effective. Fish oil decreases inflammatory pathways in the body and repairs cellular receptors. And melatonin works as a powerful antioxidant. And then there's the detox formulary, which is like type of a medical food that provides all the bioavailable nutrients in your body that your body needs to self-modulate inflammation, improve immune function, heal leaky gut, restore mitochondria for improved energy, and also eliminate toxins from your body. And then vitamin D, which stimulates immature and naive immune cells, which also helps our bodies defend against infection. It also downregulates our mature immune cells by dampening our immune response. And it's also a powerful inflammatory protectant by protecting against inflammatory damage in our body. Yet, vitamin D insufficiency is emerging as a clinical problem of global proportions. And vitamin D deficiency is linked with autoimmune disease, susceptibility, and severity. So you've got to get yourself some. As you can see, there's so much more that can be done. As for the nutrients I've mentioned, you can get all the aforementioned nutrients or supplements at our store, which is at lupuspharmacy.com. You don't have to buy from me, but it's wise to be careful with what you put into your body. And most supplements do not contain what they say they contain. They often contain many fillers and such. I'll leave that up to you to decide, but the links will be provided in this blog. I hope you enjoyed this episode. It would be so amazing and helpful if you follow and like us on Facebook. Join our private Facebook group, subscribe to our podcast and YouTube channels, and share your post or share this post with those that can use it, and subscribe lastly to our newsletter so you never miss a helpful news. That's it for today. Thank you so much. I'll see you next week.